making sure that the discoveries get to the patients is a really important part of any cancer center mission, and clearly something that we take very seriously at Lineberger.
Cancers can have different Achilles heels. Once you understand more about the cancer, you want to try and tailor your treatment. That's the promise of personalized medicine.
We are going to see 4,500 new patients this year. Each one of them is an individual. If we can change the lives of 10% of those people, in addition to what we were doing, what could be better?
We started our family back in 2001 with our daughter, Fiona. 3 years later, we had another daughter, and we were done, 2 kids. When our youngest daughter was 16 months old, they looked at her and said, "Hey, there's this rash." It turned out she had leukemia.
One of the arguably hardest conversations I've ever sat through was the "we're out of options" conversation with my daughter. So this was the take her home and help her die conversation.
Her disease was too aggressive, and we lost her in December of 2006. Our son, Phineas, was born in 2008. And he loves Legos.
Crazy into Legos.
Loves to build things, take things apart.
Disassemble things.
Make messes faster than I can clean them up.
He is a combination of, I guess, Calvin from Calvin and Hobbes, Dennis the Menace, and Bam Bam.
He's all boy.
All boy.
After having 2 girls, he was a real shock.
Yes.
When he turned 4 years old, took him to the pediatrician, and this doctor was checking him out and looked at his chest and said, "Oh, he looks like he has a rash." I knew right away when I saw that. Diagnosis number 2, leukemia. And a couple months into his treatment, we found out that it was not responding to the standard course of treatment. We had to find something else, or things were not going to go very well.
That's where we first met Dr. Ayers. He was very knowledgeable, and from the get-go, that gave me a higher level of confidence.
Because of our experience losing our daughter, we discussed with Dr. Ayers about getting into a T-cell therapy trial.
Everybody with a kid with leukemia wanted their child in one of these trials. Dr. Ayers persisted, and
within a week, we were literally on a conference call with the main doctor at NIH.
Yeah.
Immuno-oncology is the idea of using the patient's own immune system to fight the cancer. His own T cells are harvested, they're expanded outside the body, and then given back to the patient, and he promptly went into remission.
Within 28 days of giving him these modified T cells, his cancer was gone. It was gone.
In 6 months, he's rocking amusement parks under his own power.
This is big. It's like science fiction, but it's not fiction. It's real, and it saved our son.
Based on stories like Phineas's and other patients, we decided we had to develop this capability here, and we were able to build a facility that will allow us to offer this therapy to patients who need it.
We've recruited 2 of the best people in the country. We have faculty here that are ready to go. This is going to be an exploration over the next decade of curing people that you can't cure.